We are joined by Dr. Zachariah George, neurosurgeon with Neurological Surgery PC, with a specialty in minimally invasive spinal surgery. Dr. George, welcome to the Daily Dose.
Thank you for having me. It's a pleasure to be here.
All right, two words that so many of us know so well. Is it fair to assume that back pain is among the most common ailments anywhere?
Absolutely. It's the most common complaint for patients going to the emergency room or to the primary care physician.
And then we launch into another two words, spinal surgery. And for so many years, so many of us thought back surgery, that is the last option. And spinal surgery, we think of open surgery and lots of rehab and lots of pain and no full cure. That is no longer the case.
Yeah, I mean, the perception is based on, there's a foundation for that perception. It used to be that there'd be large surgeries, long recovery times, long rehabilitation times, but that really is no longer the case. And that's really as a result of these new technological advances that have taken place over the last decade or so a very short period of time, that's really ushered in this new subspecialty within spine surgery known as minimally invasive spinal surgery, or MISS for short.
All right, minimally invasive, what are we talking about specifically?
Well, it's the use of intelligent retraction systems, tubular retractors that can be progressively dilated and placed to the area that we're working on. So we bring our eyes down to the area of interest and we're able to do the surgery through these tubular retractors, causing minimal disruption to the native tissues and leaving the spine in a more anatomical fashion at the end of surgery as it was in the beginning of surgery.
What are the specific goals? You find someone who is a good candidate for this, and we'll talk about who might be a better candidate as compared to others, but the goals, what are you trying to accomplish?
Well, the goals are essentially the same whether you're doing an open approach or whether you're doing a minimally invasive approach, and really boils down to three key principles. One is to decompress the neural elements. Now, this compression may come from various forms. It could be a herniated disc, it could be from degenerative changes or arthritis, or it could be from a tumor. But regardless of the cause of the compression, we really want to make sure that we adequately decompress the neural elements, and that's principle number one. Principle number two is really paying attention to the stability of the spinal segment that we're working on. Now, there's two scenarios. One is a patient that comes to your office because they have spinal instability, whether that be from a spondylolisthesis or from a spinal fracture that leaves them unstable. Now, when these patients come to your office, you want to make sure that at the end of the surgery, if they do require surgery, that they're left with a stable spinal segment. The other scenario is a patient who comes to you for, let's say, a herniated disc or some other benign reason, let's say, and there is no issue of spinal instability. Well, in those cases, you want to make sure that at the end of the case, you leave the spine with as much stability that it had when you came in to do the surgery. So you don't want to iatrogenically or during surgery destabilize these patients. And the third principle is really paying attention to the alignment of the spine. And the same kind of scenario plays out in that a patient may come to your office because they have spinal malalignment, whether that be in the coronal plane or in the sagittal plane. So then the goal of your surgery at that time is to realign the spine in a more physiological fashion, or to the best alignment that the patient requires. And the flip scenario again is a patient who comes to your office for another reason and want to make sure that at the end of surgery that you realign the spine to where it was at the beginning of the case.
You look at all of the causes. For us as patients, we look at one word, pain. These are the benefits. This can alleviate the pain.
Absolutely. There are, tremendous advancements in pain management, whether that be from the non-operative standpoint with pain medication, with the use of anti-inflammatory medications, steroids, with the use of epidural injections and facet blocks. The field has really evolved quite a bit, and obviously we can do surgery for those candidates who require surgery, and now we can do that in a very minimally invasive fashion, which alleviates pain quickly, and also patients are able to get up and around much quicker.
You know, Dr. George, you're alluding to something that I think many of us wouldn't expect. We expect most neurosurgeons to want to operate first and not explore some of the other options before either minimally invasive surgery takes place or something even more serious.
Well, I mean, we're surgeons, and we want to operate, but certainly not every person, and actually very few patients that come into your office require surgery, and it really boils down to picking your patients correctly with the right diagnosis, with the corresponding radiographical imaging that makes sense, and the neurological exam that makes sense, and you want to operate on on those patients to get the best results, and that's what we try to do.
All right, let's talk about some specifics when someone who is a possible candidate for minimally invasive spinal surgery, what makes someone a better candidate as compared to others?
Well, I mean, you can really use the techniques in numerous patients, but there are certain subpopulations that particularly benefit from these advancements. There are patients who are not great candidates for open surgeries, like the elderly, and frequently these patients also have multiple medical problems, whether they're elderly or not. And we can do this surgery with minimal blood loss and smaller incisions, so that the recovery times and everything is much faster, and these patients don't have to succumb to those other complications that happen as a result of large surgeries, like long non-ambulatory periods where they can develop DVTs, deep venous thrombosis, etc. So those are all complications that can result from large surgeries.
What a fascinating time and an exciting time for minimally invasive spinal surgery. So it's up to us as patients to get all the information and to make a decision on which way to go, but there are so many different ways to go now. We can't thank enough Dr. Zachariah George, neurosurgeon, neurological surgery PC, with a specialty in minimally invasive spinal surgery, a very exciting field on the cutting edge. Thanks for joining us on The Daily Dose.
Thanks again for having me.